Well, hi everyone. Thank you for joining us today. I'm Cassie Goodman. I'm the Cancer Early Detection Programs Manager at Nevada Cancer Coalition. And I am here with Dr. Parikh today to talk about Paint Nevada Pink. Thank you for joining us.
Thank you. Thank you for having us. So,
Perfect. Yeah. So Dr. Parikh works for Comprehensive Cancer Centers of Nevada as a medical oncologist, and they are actually our title presenting sponsor this year. So we want to say a big thank you to them for that.
no,
And
definitely. So,
yeah, and Dr. Parikh, why is Comprehensive Cancer Centers of Nevada and you so excited about Paint Nevada Pink?
so Paint Nevada Pink is a huge awareness campaign. October is Breast Cancer Month, as everybody knows. Everything is pink around the city, and some of our icons, like the sign and the arch, some of the hotels downtown, etc., are all pink. But the reason why this campaign is so important and why we're so excited about it is because there's something that we can do to actually prevent cancer. If we can help prevent cancer or detect it early, it's a win for everyone. Not just the patients, but for us also. We never like treating cancer, but if we have to, we will. But if we can prevent it, that's much better. That's how cancer rates go down, survival rates improve. So this campaign is huge in promoting cancer awareness and prevention. So,
Great. And what are some ways that women can prevent breast cancer?
sure. So one of the biggest things, obviously, is mammograms. Every woman at the age of 40 should start getting a mammogram. If you have a family history, sometimes that can change to younger, to 35, 30 years old. But certainly monthly breast exams also help. Make sure you keep your appointments with your physicians. And obviously, if you notice something different, lumpy, bumpy, don't ignore it. Don't think, oh, it'll go away. That's when you get in trouble, when you start ignoring signs and symptoms. But mammograms are key, they're huge. Number one thing that's recommended for prevention once a year, starting at the age of 40. So,
Great. And then as a medical oncologist, why is it so important for women to get those mammograms and catch breast cancer early?
so the importance of the mammograms, as we said, is we catch those breast cancers early. No test is 100%. Even mammograms can miss cancer. But if you can get a cancer at a stage 0 or stage 1, sometimes all you need is surgery, maybe a little radiation. We don't ever want to talk about losing hair with chemotherapy or not having, other side effects of nausea, vomiting, things like that. So if we can get these cancers early, that's a win. Sometimes we get aggressive cancers, and if we can get them early, it prevents them from spreading to other parts of the body as well. So it's all about prevention. That's the key message here. So
Yeah, so prevention to help with better outcomes later on.
definitely, yeah. And essentially, it's we look at it as a pledge to make our lives better. A pledge to take care of your health, a pledge that your mammogram in the next 12 months, a pledge to help your family, and a pledge to keep cancer out of our lives. So many people are affected by cancer these days. And breast cancer is not uncommon, unfortunately. Up to 10% of women over their lifetime will get breast cancer. So we want to lower that number to less than 5% if possible, if we can prevent it from happening. So,
Oh, that would be great.
yeah.
And if anybody else out there watching would like to take the pledge with us, you can go to paintnevadapink.com and you just put in your name and who you're pledging for. It's free to do and anyone can take it. And it's just saying that you will schedule a mammogram or you'll remind a loved one to do so within the next 12 months.
Yeah, that's huge. And that message can't be said enough times, I think, especially during COVID. Nationally, it's been stated that 30 to 40% of all preventive tests, including mammograms, have not been done this year because of COVID. So we want to try and encourage patients. COVID is still out there. We certainly understand that, but don't ignore your health with it. We don't want to see the spike in cancer for the first time in years. That may happen. Hopefully, it doesn't. But your health is equally as important as the virus is, certainly. So.
Yeah, definitely. And sadly, I've seen that with some of our patients around town afraid to go in and get mammograms because
Yeah.
of COVID.
Yeah.
So,
And all the facilities that are open in the state of Nevada, especially, have gone through some extraordinary changes to try and keep COVID out of their offices. They're probably the cleanest offices we've ever seen in our lifetime, to be honest. So it is safe with the precautions that are put in place. So please go get your test done. It's critically important. So.
perfect. Yes, very important message. Do you have anything else you'd like to share with the community watching?
No, I think that, like I said, prevention is the key. We at Comprehensive Cancer Centers certainly support Paint Nevada Pink campaign, as you know. We're excited about it. We'll continue to do these interviews to get that message out there. But hopefully I never have to talk to you about a cancer diagnosis, but if you do, we have the ability to take care of that as well. So
That's good. Yes. And thank you again for being our presenting sponsor. And thank you for taking the time to be here today and do this interview.
good. Thank you so much. Thank you for having us. And we're here to help. Anyone has a question or concern, they can call our hotline. And our website is cccnevada.com. You can also leave a message for us and we'll try and answer those as many as we can. So
Perfect. Yeah. And we'll be continue to check Facebook where you're watching this video on this page, and we'll have links to comprehensive cancer centers as well. And all of the interviews throughout the month will be posted here. So thank you all for tuning in.
Thank you. Thank you.
All right.